So, what preoperative evaluations are necessary before recommending an artificial urinary sphincter to a patient?
Well, I think that obtaining careful history and physical examination is always the foundation of the correct diagnosis. We need to, number one, obtain the history, whether there were any type of, treatment for prostate cancer with radical prostatectomy or radiation. Sometimes, patients who have prostate procedures, not for the cancer, but just enlarged prostate, conventional resection of the prostate or other procedures, unfortunately can result in damage to the sphincter. So it's not just people with cancer of the prostate, just enlarged prostate, and the treatments of enlarged prostate can lead to, urinary incontinence. So you need to obtain careful history of what's been done and what's not been done in the past. And we talked about different types of incontinence earlier today, and we need to make sure that we are indeed talking about stress incontinence due to the damage to the sphincter. If a person has leakage because he's in retention, and ultrasound shows that the bladder is constantly full all the time, that's not going to be treatable with the sphincter. We also need to make sure that the patients may have urge incontinent component, but the same patients may also have stress incontinence in the cases of mixed incontinence. So it is extremely important to not mistake an urge incontinence or involuntary bladder contractions as an underlying cause of the patient's stress incontinence. So, and then the physical examination, of course, you need to be able to demonstrate that the patient, when he is standing in front of you, and you ask them to cough, that there's more than just a couple drips. If there's definitely a strong urine leak with coughing efforts, I think that's definitely the most reliable objective evidence of sphincter deficiency, as long as they don't have any urinary retention. And then in some difficult cases, urodynamic study comes in very handy, because the urodynamic study will be able to tell us, based on the parameters, provide a very objective support that you're on the right track, and these patients will benefit with the proper treatment.